Hi, I'm Dr. Mikkel Jarman, and as a pediatric foot and ankle specialist, I am often asked about children's chronic foot pain. My goal here today is to expand your understanding of pediatric tarsal tunnel syndrome to help ensure that this is at the forefront of your mind when you encounter a child that has persistent, chronic foot pain that is just not responding to our typical conservative treatments. Today I'm diving into this puzzle, tarsal tunnel syndrome, that in my early career seemed to be so incredibly hard to diagnose in this pediatric population. However, today I feel like I can almost see it a mile away. It's technically not a medical mystery, however, better understanding this tough diagnosis can make a huge difference in getting your child the right care. Our first challenge is what I call the "it just hurts" problem. It's a communication barrier. Kids are not always great at articulating anything. Try asking a 7-year-old to describe pins and needles. Even for an adult, it's incredibly difficult to articulate these nerve-specific sensations. Children will usually say, "my foot hurts," but rarely will they say, "Mom, Dad, I have a burning sensation in the arch that comes and goes. It's sharp and shooting. It feels electrical. Sometimes it feels like a firecracker or a sparkler under my foot." Instead, they use vague, generic descriptions, again, "my foot hurts," that can easily blend in with other common childhood complaints like Sever's heel syndrome, growing pains, flat feet, Achilles tendinosis, or even plantar fasciitis, which technically does not exist in pediatrics, though a lot of providers do like to give this diagnosis. Point being, it's extremely tough for anyone to isolate nerve issues when everything feels like a general foot pain. This leads us to our second hurdle, activity-based nature of the symptoms. Tarsal tunnel syndrome often acts like a phantom. It flares up during or after activities. It then mysteriously disappears at rest. This "now you see it and now you don't" pattern makes it easy for parents and even clinicians to dismiss it as a simple overuse or just a typical childhood ache rather than signaling a deeper nerve problem. Then there's the elusive physical exam. Children often point out compensatory pains that they are feeling because they're often walking incorrectly, walking on the outside of their feet, and this creates all sorts of other problems that are non-specific pains and discomforts. Objective signs like a positive Tinel sign, a specific diagnostic technique, which involves a tapping over this injured nerve, is a helpful tool. However, it can be subtle or hard to constantly elicit from a fidgeting child. Kids don't always cooperate fully and their responses can be inconsistent, making it a real challenge to gather clear, conclusive evidence during a physical exam. Finally, we encounter diagnostic dilemmas. Unfortunately, there is no one test that can be done that will give that golden ticket, that diagnosis of tarsal tunnel. The diagnosis is made by exclusion, meaning we have to use our best medical judgment in treatment to conclude that these children do in fact have a nerve impingement syndrome. While imaging like MRIs, CTs, ultrasound, and even nerve studies like EMGs and NCVs are helpful in the adult population, in pediatrics they are almost always inconclusive and less frequently used due to the discomfort or need for sedation. So diagnosing tarsal tunnel syndrome in kids is truly a complex challenge. It's a puzzle. It requires a high level of suspicion, a lot of patience, and often repeated evaluations by a healthcare professional who is experienced in pediatric foot and ankle conditions. It is often the failure of conservative treatments, a positive Tinel sign, and negative MRI findings that get us closer to a true diagnosis. Understanding these difficulties is the first step towards getting these children the right diagnosis and ultimately relief. I hope this sheds some light on this tricky topic. I'm Dr. Mikkel Jarman. Thanks for watching.